I fell in love with Dr. Rapprich basically because he gives you a comfortable feeling. I don't know how to explain it. It's just the way he talks to his patients and how he treats them. It's just perfect. I mean, I had surgery last week, and it was my first surgery ever in my life. It was the first time I was in a clinic my whole life, and so I was very nervous, as you can imagine. And then he came into the room, and it was just this good feeling, knowing that he knows what to do, he knows how to treat me, and then it was perfect. To get the appointments for surgery, it took 2 years. Yeah, I had the first appointment with Dr. Rapprich May 2011, and now it's February 2013, and last week was my first surgery. But it was worth it. It was worth waiting for it, because I know that he's one of the best in this area, and why should I go to someone else not knowing what the results might be? And then I said, no, I will wait 2 more years and then having the perfect result.
Now we use this measurement compression stockings to measure the volume of the legs. The principle is that we take now some pictures from all sides, and by a computer is calculated a 3D model, and we can exactly examine the volume of the legs. And for us it's interesting, of course, before and after liposuction. The first criteria for lipedema is this disproportion, which is perfectly visible in her case. The second is to test if we have lymphedema, and we examine the stemmer sign here. Yeah? If it's possible to lift up the skin fold, we have no lymphedema, and this is in her case. Huh? And then we check the lower leg for edema, and if there is still a hole, we have water in the legs. In her case, the fat is soft, no hole after press it. This is a perfect situation for liposuction treatment. My procedure is to do a conservative therapy consisting of lymphatic drainage and compression before. And if it's possible with this treatment to put out the edema, then I can do liposuction. For my procedure, my philosophy of liposuction is to do the treatment not in one step, but in smaller steps. In her case, I plan 3 procedures. We start in the inner thigh and knee, then out and front, and the last the lower legs. The time between the procedures for a minimum of 4 weeks.